Superbugs, infections that have become resistant to treatment by drugs, pose one of the biggest threats to humanity. Some experts think that unless something is done, even some simple infections could soon become entirely untreatable. Now, every member of the United Nations, all 193 countries, is to sign up to an action plan that it's hoped will stop the overuse of antibiotics. Here's our medical correspondent Fergus Walsh.
Antibiotics are the miracle medicines on which we all rely at some point, but their overuse means they're one by one losing their ability to kill bacterial infections. The misuse of drugs to fight parasitic or viral infections like malaria or HIV is also a major global health threat. At least 700,000 people a year die from drug-resistant bacterial, viral or parasitic infections, such as TB, HIV or malaria. Left unchecked, it's thought that could rise to 10 million deaths a year by 2050. The UK has been at the forefront of a campaign to get global action on superbugs, and the UN declaration is a symbolic step. It acknowledges that superbugs pose a wide-ranging health threat to women giving birth, to newborns, those undergoing surgery or cancer treatment.
Klebsiella, as you can see.
Microbiologists have repeatedly warned that antibiotics are losing their potency, and so urgent action is overdue.
It is a real threat. We have patients every day in UK hospitals and everywhere else throughout the world who have drug-resistant infections that they're not treated with the first drug or the second or the third, and sometimes they're not treatable at all. And if these are very sick patients, they are dying.
The UN has committed to encourage innovation in developing new antibiotics, improve diagnostics so that drugs are given only when needed, and to educate health staff and the public on how to prevent the spread of infections. There are no specific targets for governments, the pharmaceutical or agricultural sectors, and the key will be to convert good intentions into action.
Well, Fergus is with me now. Good intentions into action. Can this action plan work?
Well, I think there is some political momentum behind this issue now. The G20 a couple of weeks ago released an encouraging statement. But when we get down to the nitty-gritty, can, for example, the United States and China be persuaded to put the sort of curbs on the use of antibiotics in animal production, in farm animals, that we've seen in Northern Europe? That will be a big question. Again, can we persuade countries like India, the #1 user of antibiotics, to stop selling antibiotics without prescriptions? I was there last year and was able to buy the last-ditch antibiotic, the one you'd really depend on if you were very sick in hospital, in every pharmacy I tried. And you could buy it just one dose at a time, a real recipe for superbugs to emerge. And finally, can we persuade the pharmaceutical industry to put the money in to develop the new drugs that we need? There hasn't been a new class of antibiotics since 1987.
And the problem is that a lot of people still don't realise the dangers of overusing antibiotics.
Absolutely. I mean, I think in this country, the message is just beginning to get through in the past year or so that antibiotics are not for coughs and colds. We all kind of expect to get a pill when we go to the GP, and we've got to stop that. Message is beginning to get through, antibiotic consumption falling a small amount in the UK. And, you know, we really don't want to be in the era where if you get a cut, it turns into an infection, that there will be nothing left to treat it. And that is what we could face, a return to the pre-antibiotic era.
Fergus, thank you.